Hello, this is week 7, and this week we will be covering setting goals and objectives and using Microsoft Excel as well as Microsoft Word to do a variety of tasks from create spreadsheets in Excel to creating data sheets using Word. Each of these presentations will be in separate video formats, and notes will be posted for the goals and objectives lecture. So having said that, let's get into a discussion about goals and objectives. Thus far in the semester, we have talked about all of the tasks that a behavior analyst would go through during an initial consultation. I think we even went a little bit further than that. But just to review, let's say we are consulting to a student who is in a second grade classroom. Obviously, we are going to meet with a classroom teacher, teacher's aides, perhaps even the parents. We're going to conduct some observations and so forth. And the general idea behind that process of conducting interviews and observations and so forth would be to identify the problem, select a target behavior and or target behaviors, determine definitions for those target behaviors, and then determine how we're going to set up observations and measurement systems to record and measure those target behaviors. So we talked about obviously things like setting up observational sessions or conducting observations in trial formats or across a day, and measurement systems that include utilizing duration or a count, or converting the count into a frequency, or using discontinuous sampling methods if that would be appropriate. And then we had a discussion about inter-observer agreement. So one of the things we need to think about is once we've done that, or perhaps even during the process of doing that, what is the goal of our intervention or our involvement? Why are we there? We're there to change behavior, presumably, but we need to be able to identify and develop goals and objectives for our services. What are the outcomes going to be for our behavior change? So that's what I want to focus on now. And this will not be the last time you hear this. We'll probably talk about it in other classes, but I think this is a good place to talk about it within the context of this course. So if any of you have had any experience in psychology classes or educational classes, you probably learned about goals and objectives. But just to review, often we will describe a goal as a broad statement of behavior change or outcome, whereas an objective would be sort of specific, perhaps smaller steps to achieve the ultimate goal. Now, that said, you will see some folks will use these terms interchangeably. So they may say, well, develop a goal for this student. And they may actually be referring to an objective. So make sure you're clear on that if you're in a work setting. But formally, you would have a goal, which would be a broad statement. So for example, the student will engage in vocal greetings with classmates. Right, that may be a goal. So it sort of specifies what behavior we are expecting, but it doesn't have all of the necessary details that make up a complete goal or an objective. So the objective may be the smaller steps to achieve the goal. So these objectives may contain more detailed information about what is the actual target behavior? So when we say social greetings, what do we mean by a social greeting? How will we know when it occurs? Under which conditions should it occur? Is there prompting involved? What is the criterion, the performance criterion? So what are we looking for to say that this goal or this objective has been met? So keep that in mind as we go through this, but let's work under the general format as a goal will be a broad statement of behavior change or outcome, whereas the objective is going to be specific, smaller steps to achieve that goal. I guess just to expand on that in sort of another format, we may interact with parents who would like their child to speak, right? So if we're working with a child who has vocal deficits, communication deficits, and they're not speaking, the parent may want the child to speak. And we may be a long ways from that goal with even the best interventions. So we certainly should try to convince the parents to have a more reasonable goal. But if that is the goal, the objectives are going to be very small steps. So objective 1 may involve vocalizations of phonemes, right? So individual sounds of letters. Other objectives might be full words. Other objectives could be sentences, all of which presumably will get the child to the goal of communicating to various degrees. So again, I think that provides some additional context for goals versus objectives. So the next thing we need to consider is, will the goal and or objective be written for a behavior deficit or behavior excess? So this is a way in which we sort of formally talk about the work that we do. So that is, we are working to remediate individuals' behavior deficits. So regardless of the individual's diagnosis, they are presenting with skill deficits, whether it's academic skill deficits, independent living skill deficits, vocational deficits, any deficit, any performance deficit we can work on. So I call that work skill acquisition work, right? So that means there's been an identified behavior deficit or skill deficit, and we are going to develop programs to improve those deficits or remediate them, right? So we're working on teaching the individual skills, so they are acquiring behavior. Whereas behavior excess is essentially addressing problematic behavior. So both of these areas are important to the development of goals and objectives. So we could think of it loosely as in behavior deficits, we are involved in teaching. So the goals are going to be developed and phrased in a way that indicates that we are teaching a skill, whereas behavior excesses or problem behavior is going to be phrased in a way that we are decreasing some behavior. And then we need to set a criterion for change. I'll talk more about this on later slides, but how will we know when the skill has been achieved, right? So we could teach certain skills, but is the client actually engaging in them fluently, right? So for example, I know how to play a little bit of piano. I'm clearly not fluent in it, so I still have behavioral deficits related to performing on that instrument. So we would need to specify what is the expectation for performance. Are we looking for flawless, fluent performance, or are we looking for even prompted performance, right? So we could set that up within our performance criteria. And again, I'll talk more about that on a later slide. But suffice to say here, what we should be doing, particularly with the populations we often find ourselves working with, is ensuring that the criterion is not too high, basically ensuring success, right? So we want to try to work our objectives and our goals in such a way that the individual can succeed, yet make progress on the ultimate goal. So we often refer to SMART goals, right? This is an acronym referring to the goals should be specific, measurable, achievable, relevant, and time sensitive. So when you're writing goals and or objectives, again, I'm sort of blurring the lines there between those two. We want them to be specific. That means that they identify specific target behavior or target behaviors to increase or decrease, and we have a clear outcome of what we're looking for. Right? We want the child to vocally request their favorite item, right? The goal could be as specific as that. The student will refrain from engaging in any self-injurious behavior, right? So we're specifying the target behavior and indicating what the outcome should be. To a certain extent, the overall outcome. The goals should also be measurable, right? So we talked about measurement. So they should be measurable. They contain measurement criterion for the target behavior. It may be with respect to problematic behavior like self-injury, the behavior will not occur, right? 0 instances is part of the goal. 0 instances of self-injurious behavior. Maybe that is too high of a criterion. So 10 or fewer self-injurious behaviors. If we're teaching behavior, maybe 5 out of 10 trials, right? We want the child to engage in a peer communication, or 80%, right? That's probably a better goal. So we have some measurement attached to it. 80% of trials, Johnny will independently greet a peer. They should be achievable, right? We talked about that. So we want the goals to be developed in such a way that's going to ensure the client succeeds. We don't want to set criterion too high or the person will never meet the goal. And that would be problematic, right? So we want them to achieve the goal, but we don't want it too low that it's exceptionally easy. We want them to make progress. So that is not always easy to figure out, but we'll talk about some ways to figure that out shortly. The goal should be relevant. We talked a lot about this when we discussed selecting target behavior. So obviously the behavior should be socially significant, meaning it should have some significance to the individual in terms of improving his or her life. The stakeholders, parents, teachers, caregivers, should all have a say sort of in the social significance of the behavior. Now, when we discuss selecting target behaviors, I think we talked about this quite a bit, so I don't want to belabor the point here, but if it's a problem behavior, those are pretty easy to select, right? So if a parent comes to us for help with their child's self-injury, that is a target behavior. Some behaviors are not so easy to select though, right? If a parent comes to you because their child's been expelled from school and they want you to set up an educational program in the home for their child, what are the target behaviors, right? What are the goals? How are we selecting those? That's a little more complex. The goals should also be time sensitive, meaning they should have a start time and an end time. Now, I don't always include a start time in my goal, that the goal will start at this time, but it certainly has an end time. And what this does is it allows us to monitor progress and monitor our success as a behavior analyst. So it holds us accountable. If we are not moving toward completion of a goal or objective, then we need to change what we're doing. We need to have a different intervention or revise the intervention. So by having these time-sensitive goals, it's holding us accountable to bringing about behavior change that's necessary. So often, I'll talk about this later, but often when you think of the goal being time-sensitive, if you're in an education environment, there are IEP meetings, individual education plans, where you are meeting with a team and discussing the progress on your goals. So we'll talk about how to consider that in development of your time sensitivity. If you're working in a setting with adults and it's a habilitation plan, often called an IHP or a service plan, the goals, again, should be time sensitive. You don't want to work on something an entire year and not make progress. So we want to make sure that we're checking in on a regular basis to monitor progress toward these goals. But you don't want to set yourself up for failure either, that your goal is set to be achieved within 2 weeks and the individual is not quite there, right? So you need to consider what your time sensitivity is going to be, and we'll talk about that on a later slide. So goals and objectives come in a variety of formats, but all of them contain certain elements or certain content. So this is this has implications for my earlier discussion about some people using the term goal and objective interchangeably. So some folks may say a goal and have the goal contain all of these elements, whereas others will say, well, the goal should be broad, the objectives contain all of these elements. So keep that in mind. So I'm trying to allow you some flexibility. So when you enter these different environments, you're not thrown off when somebody says, write a goal, and you may write something broad and they say, no, you have to have measurable criterion and so forth. So keep that in mind and, get clarification. So goals and objectives, or I'll focus on objectives. Objectives should have each of these elements: the description of the person, the target behavior, the conditions under which the behavior is to occur or not occur. And I don't mean both. I mean, if you're talking about skill acquisition, what are the conditions under which that skill should occur? If you're talking about problem behavior, what are the conditions under which that behavior should not occur? So if it's skill acquisition, maybe the behavior occurs during a verbal prompt, or following a verbal prompt rather. Following written instructions, the student will complete math problems. Or following the presentation of a worksheet, the student will remain in his or her seat. Other conditions might be times of the day, right? So during lunch, this behavior will occur. Across all waking hours, this behavior will not occur. So again, there isn't necessarily guidelines. You have to consider the individual, the presenting problem, and the context to figure out how we're going to describe the conditions. And then, of course, you want your performance criterion. The goals and objectives need to be measurable and time limited or time sensitive. So let's reflect a little bit on how we might select goals and objectives. And I already alluded to this earlier, but one of the areas that's probably most difficult for new behavior analysts to wrap their head around is addressing behavior deficits. So if you were called in to consult to a second grade classroom because a student was experiencing skill deficits, that essentially means that there's a curriculum in that class, but the student is not meeting the appropriate performance criterion. Right? And we could figure out why that may be, or if there are any particular variables influencing why there is that deficit. But first and foremost, we have to figure out where are the deficits. So is it across the entire curriculum, or is it in a certain area? And that's not always easy, right? So how do we figure out what we're going to select as targeted goals and objectives? And this may be synonymous with the target behaviors we select if we're in an education environment. So follow me through this. If I were consulting to a second grade classroom because a student was not performing well, I obviously would have a consultation or an interview with the parents, well, certainly the teacher and teacher's aides, because this is a classroom setting. I may consult with the parents or caregivers, right, to figure out, well, what is your perception of where the deficits are, right? And that may guide me a little bit further. The next thing is I'm going to conduct some form of a baseline assessment. Now, again, this is pretty unwieldy and broad. We're in a classroom. There are skill deficits. In what areas? Is it math? Is it language arts? Is it reading and writing? Is it play? Is it social? So we need to figure that out. And it may be done through observation, obviously, again, in consultation with the stakeholders, teachers, parents, and so forth. But when we get to the point of really determining the current operant level or baseline, we need to conduct a baseline assessment. Now, there are some tools that we can use, and we'll talk about these in other classes. But if we're working on language, verbal behavior, we can utilize the VB map, which is an assessment tool that helps us identify where the deficits are, and it helps us actually develop goals to target. If we don't have access to those, and they're not necessary, they are helpful, but they're not necessary, what I tend to do is use an informal assessment. So by consulting with the teacher, I learn, well, what is the curriculum? What are you doing on a day in and day out basis? And where do you see the struggles? So let's just say they identify math and reading. Then I want to get from the teacher, or I could go to a second grade curriculum book and get examples of what they should be working on. So let's just say, it's 2-digit addition problems, right? So 10 plus 10, 10 plus 12, things like that. Then I want to formulate a little test, right? And I could do it in a variety of ways. Let's keep things simple and say I set up 10 trials where I present 2-digit addition problems, double-digit additions. And I have the child perform. I say, add, right? They complete one, great job. Add, maybe they do or don't do or get the next one wrong. So I'm trying to assess what is their current performance. And I'm going to do this in a repeated measure fashion. So let's just say my first run of 10 trials, they got 20%. My next run, they get 10%. The next run, they get 15%. So there seems to be a deficit there, right? They're not reaching 100%. They're not even reaching 80%. So that might lead me to identify that as a goal. So it really is kind of as simple as that. Although, again, you could see that that's a lot of effort to identify multiple targets, right? So consider that. For behavioral excesses, again, I already described this, so I don't want to spend too much time here. Obviously, we're consulting, we're conducting interviews, doing observations, and there would be a baseline assessment. If we do a functional analysis for those in the 510 class, we learn the conditions under which the problem behavior occurs. So that means we need to treat the behavior in that condition. That also provides us some level of baseline performance. So problem behavior occurs under these conditions at this level. Therefore, we need to decrease it to this level. So let's just consider that in another example here. I'll do some drawing on graphs. So let's say we are looking at a skill acquisition problem. So let's say it's social. The individual is not communicating with peers, and that's something the parents and the teacher would like the student to work on more. So that's an interesting scenario because it's difficult to arrange trials, right? We expect it to occur naturally, but we might have to contrive trials in that sense. So let's just say we run 5 trials of sitting down with the target student who's experiencing the problem, and we work with another student. We say, hey, Bobby, go tell Mary hello. And Bobby doesn't do it, right? So we mark 0, right? Maybe we run multiple trials and we see he never does it. We do another observation, right? And he does engage in a few, but we want him to be engaging in this behavior 100% out of all opportunities. So we need to, for baseline, we may need to contrive those opportunities. Now, of course, we could just do it in a naturalistic observation. We could just sit with him across the entire school day and measure how often he engages with a peer. And it may be 0, it may not be 0, but if our teaching is likely to occur in a contrived format, so it might be better to assess baseline under that condition as well. And then, of course, the goal is probably going to be, typically I would do something like, you probably can't understand that, but 80% would be a target, right? I mean, if the behavior is rarely occurring, I may go lower, perhaps starting at 50. So we're teaching, hopefully we start to see the behavior increasing. Then maybe he gets to 50% and he's met objective 1, right? The next objective, he has to get to 80% and so forth for X amount of trials. So that may be one example. Again, if we're talking about problematic behavior, I conduct observations under conditions in which the problem behavior is likely to occur. And that actually will help me determine, performance criterion as well. Right? So now I could see, let's just say this is 80% of intervals, there's problem behavior. So I might select to reduce that by 90% of baseline levels. I could do some calculations to figure that out. But my first objective may be to reduce it to a certain level, right? Obviously, ultimately, we do want to get to 0, but if that's going to be too difficult early on, we want to select achievable performance criterions. So our baseline observations and measurement can help us determine what those performance criterion are. Right? Again, even if the ultimate goal is to get to 100% or 0, there are steps in between. Right? If the individual is not communicating, getting to 100% is going to be far off. So we need to set more manageable goals. Okay. So selecting target behaviors for a goal or objective is pretty basic. And we've talked about this in terms of selecting target behavior. So I don't want to spend too much time here, but obviously, again, we're considering, is it a skill deficit or problematic behavior? If we're working on developing IEP goals, education goals, they may be derived by grade and age level assessment, kind of as I just described. If it's a second grade student, what do second graders do? What should they be doing? What is the curriculum? Habilitation goals obviously could be derived by comparison of the normative samples, right? So what should individuals at 20 years of age, what skills should they have, right? So we could take a normative sample. And then, of course, social significance is always going to play a part in our selection of target behaviors. We can consider, if we're working on decreasing challenging behaviors, instead of decreasing the challenging behavior, we can actually phrase the goal and objective into teaching an appropriate alternative behavior. And I think I've discussed this in the past, but it probably there's a little more detail here. So consider we are called in to address a student's noncompliance. Well, we talked about that as failing what's called the dead man's test. If a dead person can do it, it's not a behavior. So rather than target noncompliance, my approach would probably be to ask the stakeholders, again, teacher, parent, caregiver, well, what are the commands or the demands with which you want the student to comply, right? Where are the most problems? Is it complying with cleaning up after himself? Is it a problem complying to transitions or completing work, or all demands? So no matter what you ask to do, there's no compliance. So I would write my goal in a way that indicates we are going to increase compliance rather than decrease non-compliance. We're going to increase Johnny's compliance to following the teacher's instructions to do A, B, C, and D, or just simply increase compliance to adult instruction, right, or demands. Some other examples. If a student calls out in class, right, do we want to decrease calling out, or do we want to increase raising hand to answer questions or ask questions? If the student or individual breaks toys or engages in disruptive play, let's increase appropriate play. If the individual refuses medication, let's not decrease medication refusal, let's target medication compliance. So this is important to consider because this is where the finesse of selecting target behaviors comes in, right? You can't just necessarily say, well, the students are non-compliant, we're going to decrease non-compliance, because you probably have a much easier time increasing compliance to specific things. So this helps us specify and narrow not only our goals and objectives, but also what are the appropriate target behaviors. So hopefully this makes sense and helps build upon what we've already discussed in terms of selecting target behaviors. So always think about that. Can we change this into increasing some appropriate behavior? With respect to the performance criterion, we want to make sure that we have acceptable performance. What is the goal? What is the ultimate objective? And you often see these sort of stock measures or stock performance criteria in journal articles or other IEP goals or IHP goals. So often I'm thinking in terms of 80 to 90% marks, right? 75% is pretty low, 70% is low, 50% is low. So if I'm talking about increasing a behavior, I'm probably looking at increasing it to 80% or higher. So if it's peer greetings and I set up teaching trials, let's just say there are 10 opportunities, teaching trials through the day where the student can greet a peer. And I set this up, I have some prompting involved. That means for 8 out of 10 of them, they should be greeting the peer according to a certain criterion. So if it's higher, fantastic. If it's lower, they're not meeting the performance criterion. So you need to consider what that is. And as I mentioned on the previous slides, it's probably going to be derived from your baseline levels. If a student has, if you're measuring a skill and it's at 0, 80% is probably pretty high to start. So you may start in a little bit lower. But there are other variables we consider as well, and I'll try to make examples of that when I go through specific goal examples. Time limited, you want to specify the time and duration for the performance, or essentially how long does that performance criterion need to be maintained before you say the goal and objective are achieved and you're moving on to the next one. And again, this is sort of contextual based on how you're working and the setting in which you're working. Are you looking for the social greeting to occur for 5 consecutive sessions, and once that's done, you move on to something else? 3 consecutive sessions, 4 consecutive days, 2 consecutive weeks, 3 months, right? So we need to consider getting the behavior to the performance criterion, but it needs to maintain there before we change, right? And how long do we want it to maintain? And again, that is individual and contextual, depending on what the goal and setting is. So let's look at some examples. This is an arithmetic example. So let's just say we're working under the format of a broad goal with a more specific objective. So the goal is Jason will master basic computation facts at the first grade level. And the objective that I derived from doing assessment, working with the teacher, is giving a worksheet of 20 single-digit addition problems in the form of 6 plus 2. So that's an example. And the written instruction, find the sums, Jason will correctly complete 18 of them for 3 consecutive math sessions. So now let's sort of break this down. We're describing the conditions under which the behavior should occur. So Jason should be finding the sums, engaging in completing the work when there's a worksheet of 20 problems on there. And, these are single-digit addition problems, and the written instruction. So this is actually indicating he needs to read too, right? He needs to read the instruction, find the sums. Jason will correctly complete 18 of them. So we're allowing flexibility, right? He gets some wrong, but we want him to correctly complete. Now, this is critical too. If I were to just say Jason will complete 18 of them, that doesn't specify whether he needs to get them correct. So he could essentially get all of them wrong, but if he completes 18 of them, he's met the objective. So be careful how you're phrasing things, right? He will correctly complete. This doesn't specify whether he should be doing it independently or with help, so that may be important. We may want to look at that as well. Okay, here's another one, one that I've kind of been using previously. So social greetings. Jason will independently greet peers. So the objective, we're going to be very specific because our assessments and our interviews led us to be this specific. During the lunch break, following a prompt from staff, Jason will independently greet 2 peers. The objective will be met when Jason meets 100% independence for 2 consecutive weeks. So we're saying this greeting behavior has to happen during lunch break. The staff will prompt, so they'll say, hey, Jason, go say hi to your peer. And he will independently greet the 2 peers. Now, this is a little confusing, but after the therapist tells him to greet the person, he goes over and does it independently, as opposed to with a script or with additional prompting. Then we're saying the objective will be met when Jason does this with 100% independence for 2 consecutive weeks. So after that, we need to revisit. Has he met this objective? And if so, do we make adjustments or do we move on to the next goal? Here's an example of challenging behavior. Tanika will decrease out of seat behavior. So that's the goal. But I elected to change that problem behavior into teaching appropriate behavior. So in the period from 9 to 9:20 a.m. functional academics, Tanika will remain in her seat with no verbal instruction unless given permission by the teacher to leave for 5 consecutive days. Right? So we're specifying the time period. We're only targeting this 9 to 9:20 time. She has to remain in her seat, so that's going to be defined in a particular way, for 5 consecutive days. So if she is in her seat during this time for 5 days, then we could change the objective. Here's an example with 2 objectives. So Joe will refrain from engaging in self-injurious behavior. Following the implementation of FCT, that's functional communication training, Joe will engage in less than 2 instances of SIB during all waking hours for 2 consecutive weeks. So in order to meet this goal, he has to engage in less than 2 instances for 2 consecutive weeks. So we're measuring his SIB every day during all waking hours. And if he goes 2 consecutive weeks where there's less than 2 instances, so he can engage in 1 per day or 0. So if he does that, then he's met the objective. Then we may change the objective. Sometimes we write these out in advance, but let's just say we're responding to him meeting this goal. So the next goal is going to be more challenging. So Joe will engage in 0 instances of SIB during all waking hours for 4 consecutive weeks. So now we're sort of increasing the criteria. And then to wrap up with a few tips. When writing goals and objectives, or really anything you're writing professionally, even for the program, write it, review it, and revise if necessary. It's always helpful to have a colleague read over things to make sure it makes sense to them. And they may even offer you constructive criticism. particularly with goals and objectives, because they can be challenging to write. You also want to consider the context when determining the sensitivity of goals and objectives. Keep in mind that for many of us as behavior analysts, we're not just working with one individual, we are working with many individuals. I've worked in some settings where my caseload was over 25 individuals, all of which had certain goals and objectives. And I would have to monitor each of these. So it can become unwieldy. So my recommendation is to consider the context when determining how long you're going to work on the objectives. Often what I would try to do in considering the context is work it around how often IEPs were reviewed. So if an IEP team was meeting quarterly to review a student's progress, I would set my objectives quarterly. So that meant when the next time I had a meeting with an IEP, I could then determine if the student had met the goal or not, make adjustments from there. So you want to do that. You want to consider the context. And we don't always have that luxury, but if you're working in settings where you can go a month or two without looking at the goal or objective, that's probably more manageable than if you're every 2 weeks looking at 50 goals and objectives for each individual. That could be hard to manage. So consider that. All right, the last thing I'm going to do is I will post this. This is actually an in-class activity, but since we are online, I will post this as an assignment. It is not graded. You do have to complete it, though, for credit for this class. And what I want you to do is select one of these cases and write a goal broadly with 2 objectives. And I'll specify this in the instructions. So you will do this in a Word document and you will upload it and I will review it. And it'll just give me a chance to provide feedback on your writing of goals and objectives. So you'll be able to select any of these cases, write a broad goal, and then 2 objectives. So in a sequence, first objective obviously should be set in a manageable criterion. The next objective should be a little more difficult. Okay, and use the examples that I provided.